Hello, I'm Dr. Aamir. Welcome to today's health awareness session. Today we will discuss a medical condition called hemorrhoids or piles. Before we start our session, it is requested to subscribe to the channel and share with your loved one and community for health awareness.
Dr. Aamir, what are hemorrhoids or piles?
Hemorrhoids, also known as piles, are swollen blood vessels in the rectal or anal area. They can cause discomfort, pain, itching, and sometimes bleeding during bowel movements.
Dr. Aamir, what are the causes of hemorrhoids?
Hemorrhoids can be caused by factors such as straining during bowel movements, chronic constipation or diarrhea, prolonged sitting or standing, obesity, pregnancy, and a low-fiber diet. Additionally, aging and genetics can play a role in their development.
Dr. Aamir, what are the signs and symptoms of hemorrhoids?
Symptoms of hemorrhoids include pain, itching, or discomfort around the anal area, bright red blood during bowel movements, swelling, and a lump near the anus. They can also lead to irritation, leakage of feces, and a feeling of incomplete bowel evacuation. Consulting a doctor is advised for proper diagnosis and treatment.
Dr. Aamir, how does a doctor diagnose hemorrhoids?
Doctors diagnose hemorrhoids through a combination of medical history, physical examination, and, if necessary, visual inspection using an anoscope or sigmoidoscope. They may also recommend additional tests such as a digital rectal exam or colonoscopy to rule out other conditions. Proper diagnosis ensures appropriate treatment.
Dr. Aamir, what are the types of hemorrhoids?
Hemorrhoids are classified as internal, inside the rectum, or external, under the skin around the anus. Internal hemorrhoids are further categorized into 4 grades based on their severity.
Dr. Aamir, what is grade 1 hemorrhoids?
Grade 1 internal hemorrhoids are the mildest form, usually not visible or felt externally. They are confined within the anal canal and may cause minimal discomfort, bleeding, or itching. Treatment often involves dietary and lifestyle changes, fiber supplementation, and topical treatments. Consultation with a healthcare professional is recommended for proper management.
Dr. Aamir, what is grade 2 hemorrhoids?
Grade 2 internal hemorrhoids are more advanced than grade 1. They may still remain inside the anal canal but are larger and may occasionally protrude during bowel movements. These hemorrhoids can cause discomfort, bleeding, itching, and a feeling of incomplete bowel evacuation. Treatment may involve dietary changes, topical treatments, and medical procedures if necessary.
Dr. Aamir, what is grade 3 hemorrhoids?
Grade 3 internal hemorrhoids are further advanced and tend to protrude outside the anal canal, especially during bowel movements, but can be manually pushed back in. They can cause significant discomfort, bleeding, itching, and a sense of fullness. Medical interventions, including procedures like rubber band ligation, may be considered for treatment.
Dr. Aamir, what is grade 4 hemorrhoids?
Grade 4 internal hemorrhoids are the most severe. They are permanently prolapsed and cannot be manually pushed back inside the anal canal. These hemorrhoids may cause intense pain, bleeding, itching, and difficulty with hygiene. Medical procedures, including surgery, might be necessary to manage this advanced stage.
Dr. Aamir, what is the treatment for hemorrhoids?
Hemorrhoid treatment includes lifestyle changes, such as increasing fiber intake, staying hydrated, and avoiding prolonged sitting. Over-the-counter creams, ointments, and suppositories can provide relief. Medical procedures like rubber band ligation, sclerotherapy, or surgical removal might be necessary for severe cases. Consult a doctor for proper evaluation and guidance.
Dr. Aamir, what is rubber band ligation?
Rubber band ligation is a medical procedure to treat internal hemorrhoids. A small rubber band is placed around the base of the hemorrhoid, cutting off its blood supply. This causes the hemorrhoid to shrink and fall off within a few days, reducing symptoms like bleeding and protrusion. It's a common outpatient procedure.
Dr. Aamir, what is sclerotherapy?
Sclerotherapy is a medical procedure used to treat hemorrhoids. It involves injecting a chemical solution directly into the hemorrhoid, causing it to shrink and eventually scar over. This helps to reduce symptoms such as bleeding and discomfort. Sclerotherapy is often used for smaller internal hemorrhoids and is performed on an outpatient basis.
Dr. Aamir, how much time is required to get well after hemorrhoid surgery?
The recovery time after hemorrhoid surgery can vary depending on the type of surgery performed and individual factors. Generally, recovery may take a few days to a couple of weeks. Less invasive procedures might have shorter recovery periods, while more extensive surgeries might require a longer healing process. It's important to follow your doctor's post-operative instructions for a smooth recovery.
Dr. Aamir, what is instant pain relief from hemorrhoids?
For instant pain relief from hemorrhoids, you can try over-the-counter creams or ointments containing ingredients like hydrocortisone or lidocaine. Soaking in a warm bath, sitz bath, can also provide temporary relief. However, consulting a healthcare professional is important for proper diagnosis and guidance on managing hemorrhoid pain.
Dr. Aamir, who is most vulnerable to hemorrhoids?
People at greater risk of hemorrhoids include those with a family history, pregnant women due to increased pressure on blood vessels, individuals with chronic constipation or diarrhea, and those who frequently lift heavy objects. Sedentary lifestyles, obesity, and aging also increase vulnerability.
Dr. Aamir, do hemorrhoids happen in children?
Yes, hemorrhoids can occur in children, although it is relatively rare. They are more commonly seen in adults, particularly those over the age of 45. Hemorrhoids in children are often related to factors like chronic constipation, prolonged straining during bowel movements, or certain medical conditions. Consulting a pediatrician is advised for proper evaluation and management.
Dr. Aamir, what is the prevention of hemorrhoids?
Preventing hemorrhoids involves maintaining a high fiber diet with fruits, vegetables, and whole grains, staying hydrated, avoiding excessive straining during bowel movements, practicing good bathroom habits, exercising regularly, and maintaining a healthy weight. Avoiding prolonged sitting and managing chronic constipation or diarrhea can also help prevent hemorrhoids.
Heartfelt thank you, Doctor, for the enlightening health awareness session. Your insights have empowered us with valuable knowledge. Grateful for your dedication to spreading awareness and improving lives.
I appreciate your kind words. Promoting health awareness and providing information is important for well-being. Please subscribe to the channel and share in your community for health awareness.